Chapter 3, Video 4. Today we're going to talk about drains. We've got different types of drains. We have open drains and we have closed drains. The Penrose Drain here, the Penrose is an open drain. The Penrose allows fluid to collect in the wound dressing away from the wound, okay? So if you look at this next slide, when we're talking about the Penrose Drain, we have this nice little slotted gauze here. This drain is open. Stuff comes out of this drain and it collects into the dressing around that wound bed, okay? So it allows for drainage, but the drainage is going into a dressing that wicks this away, and it's getting the drainage away from the wound. Sometimes drains may be very alarming, so we need to always listen to the patient, be compassionate with the patient, and we need to make sure that we report any concerns that the patient may experience to the nurse. So if the patient is expressing some concerns, we need to make sure the nurse and the doctor are aware. Now we're going to talk about the closed drain system. The closed drain system consists of the Jackson-Pratt drain and the Hemovac drain. So if we're looking at this, this drainage, this tubing here is placed inside of the wound bed, and then you can take this bubble, this bleb, and there's a spot at the top where you can open it. And once you open it, you mash it flat, and then you put the cap back on it. And that allows for suction. So this is placed in the wound bed, and this allows for gentle suction. And this drainage comes back into this bubble. And in this bubble, when it's full, that bubble will expand back out, and you can measure your drainage, and then you can discard of it. And then you can start over again. You can mash the bubble back flat and let it drain again. The same as with this. This system here, it squeezes down flat, and then it allows for vacuum. And this is the Jackson-Pratt system. And then we have a Hemovac drain. A Hemovac drain is it's actually like a wound vac. And we'll get into that later. I'm not sure. I don't think we have a picture here. But with the Hemovac drain, it's a special dressing that is put over the wound bed, and then it's sealed off with this transparent dressing, and it don't allow for air, and then the machine actually sucks, and it allows for a vacuum, which pulls the drainage out of the wound. When we're talking about wound cleaning, we need to make sure that we're cleaning the wound properly. If we are ordered to remove sutures or staples, we must do so. And we need to make sure that we're looking for that dead necrotic tissue, and if it's there, we need to talk to the doctor about it, about possibly having it debrided. We need to always report that when we see it, because the doctor would need to debride that dead tissue and get it out of the way so we can promote healing through the healthy tissue. When performing wound care, you need to make sure that you remove the tape gently. We can remove tape, like if we're changing the dressing out. A lot of times people who've had wounds for a very long time, their skin becomes sensitive to the tape because it's been exposed. So we just need to make sure that we're moistening that with some saline and gently removing that tape so we don't cause any harm. Saline is one of the things that's most commonly used to clean the wound because it does not damage healing tissue. And it doesn't sting the patient. So we never pour alcohol on a wound bed because alcohol starts actually killing that healthy tissue. So that saline is just a good neutral solution to use, and it does not burn the patient. When we're cleaning the incision site, there's things that we need to note, and we need to report to the nurse immediately if we notice these. And that would be the edges of the wound that are gaping open between the sutures or the staples. If we see sutures or staples that have been ripped out or broken. If we see excessive swelling along the incision line, or excessive redness along the incision line, or if that incision line is hot to the touch. These are things that we need to report. Purulent drainage or pus is seen along the incision line. We need to report that. That purulent drainage is like a yellow. It looks kind of like infection. It's kind of like pus. If we have wound drainage that has a foul odor, if the patient complains of increased pain at the site 2 to 3 days after the injury took place, if fever occurs 24 hours or more after the surgery or injury took place, or if we have increased amounts of bloody drainage seen on the wound dressing, we need to report that. Cleaning the wound using sterile technique. We need to always clean. One thing that I want to point out to y'all with sterile technique is we need to always clean from the top of the incision and stroke downward. When cleaning the wound, you need to make sure that you report everything that we talked about in this slide. And if you have to flush a wound, if you're ordered to flush a wound out, we need to make sure that we use a large tip syringe, because that smaller tip syringe, if we apply too much pressure, it could be harmful to the tissue. So that large tip syringe kind of disperses the water over a bigger area. And with that being said, it's not as likely to harm that tissue. Here's some different types of wound drainage that you guys need to know and be familiar with. The serous is a clear and watery looking drainage. Sanguinous is bloody. Serous sanguinous is pink and watery looking. And purulent is thick and ranging in color from dark yellow to green to creamy white. And then the process of removing sutures and staples. So you'll see here with removing sutures, and we'll go over this in the lab, you pull the suture line up, you clip, and then you can pull that stitch out with these tweezers. And then with the staples, there's a special tool. You just go right up under the middle of the staples, you close it, and when you do, it pops these edges up and pops those staples out. Here's a photo of pen care. We often see these kind of pens in children with certain breaks, and we have to make sure that we're keeping where these pens are going into the skin from the outside. We have to make sure that we keep those really, really clean, because that is a portal of entry. That puts this patient at risk of infection, because there's somewhere right here that's open that can allow infection and bacteria to travel up into this person, and it could cause that infection. There's different types of debridement. We have a sharp debridement, which is surgical. We have mechanical, autolytic, enzymatic, biological, and vacuum-assisted closure. Guys, I want you to be familiar with these, so please go to your chapter and look up the differences between these. But if you have any questions, obviously I would like for you to reach out to me. Thanks, and have a great day.